Vanderpoor, and my group did glaucoma. So what is it? Glaucoma is a group of eye conditions that damage the optic nerve. And so it usually involves damaging to the structure that allows the aqueous humor to drain out. And there are two different outlets for the aqueous humor to drain, the trabecular meshwork and the uvascular outflow. And so there are two different kinds of glaucoma, and it's categorized by how the two drainage pathways are damaged. So the first one is open angle glaucoma, and this is the most common type. And then so it's when the trabecular meshwork offers increased resistance to fluid outflow, which causes the pressure inside your eye to build up. And then the other kind is enclosed angle glaucoma, and both the uvascular drain and the trabecular meshwork become blocked. And typically this is caused because the iris of your eye becomes damaged, blocking the outlet. So some symptoms and assessment. So many forms of glaucoma have no warning signs, and the effects are gradual, and so you may not notice them until your vision condition worsens in advanced stages. And so some symptoms of open angle glaucoma are patchy blind spots in your peripheral and central vision. And then as it worsens, you'll get tunnel vision in the advanced stages. And then acute angle closure glaucoma is you'll have a severe headache, eye pain, nausea, vomiting, blurred vision. You'll see halos around the lights and eye redness. So some risk factors, so if you already have an increased internal eye pressure, if you're over 60 years old, if you have a family history of it, as it runs in families, different medical conditions such as diabetes, heart disease, high blood pressure, and sickle cell anemia, being extremely nearsighted or farsighted, and then having an eye injury or an eye surgery. So some different causes for it. For open angle glaucoma, it's an overproduction of the aqueous humor, or it's an obstruction of its flow. So this causes the aqueous humor to build up, and when that happens, the pressure inside of the eye damages the optic nerve, and so the buildup can occur because the trabecular meshwork in the eye becomes partially blocked. And then an acute angle closure glaucoma is when the outflow of the aqueous humor is obstructed, and so this is typically a more sudden form because it can result from pupil dilation, stress, or injury to the eye, which damages the drainage. And then so the diagnosis, so they will review your medical history if anyone in your family has had glaucoma, or if you have had any past eye surgeries, eye injuries, or any medications that you're on. They'll also do a comprehensive eye exam. They'll do a tomometry, which is measuring intraocular pressure in your eye. And they'll be testing the optic nerve for damage, which they use a dilated eye exam and image testing. They'll also do a field test, checking for areas of vision loss. They'll do patchmetry, which measures the corneal thickness. They'll also could do a gonoscopy, which inspecting the drainage angle. So some treatment, if glaucoma is caught early enough, then the treatments can help, but if the symptoms that you already have cannot be reversed, so the treatments are mainly to slow or prevent further vision loss. So the first thing that doctors usually prescribe are eye drops, and so they work to improve the eye's ability to drain fluid, therefore decreasing the internal fluid pressure. And then if they do not work, then doctors may prescribe oral medications as well. And then doctors could also have surgery, and other therapies. So some of these are laser therapy, which is an option for open angle glaucoma. And it is done in a doctor's office where you use a small laser beam to open clogged channels in the trabecular meshwork. And it may take a few weeks for the effects to become fully apparent. They may also do a filtering surgery, which is when the surgeon creates an opening in the white of the eye and removes part of the trabecular meshwork. You could also put in drainage tubes, which an eye surgeon will insert a small tube shunt in your eye to drain away excess fluid or lower your eye's internal pressure. They also could do minimally invasive glaucoma surgery, which will lower the eye pressure. And so this is less immediate post-operative care and has less of a risk than the other options. And so this is done in combination with cataract surgery, and there are a number of different techniques available when doing this, so the doctors will talk with your loved ones about what is the best option for them. And also just different lifestyle changes can promote your eye health. So it can be eating a healthy diet, exercising, limiting caffeine, or increased water intake. So prognosis and follow-up. If glaucoma is treated early enough and correctly, then blindness should not occur, but if glaucoma goes untreated, then it will result in blindness. So it is important to find support groups because once you are diagnosed, you'll be facing lifelong treatment and doctor visits, possibly vision loss. So talking with other people, with your loved ones, it can be really important to understand what can be expected. And you need to be prepared when going to your doctor visits. You need to have a list of your current symptoms that you are having and any medications. You can also use some prevention measures, so preventing the disease to worsen can help. Some things can do that for are bending at the waist, lifting heavy objects, coughing, vomiting, straining to have a bowel movement. And you need to also understand your medications or eye drops that your provider provides for you. So helpful ways to remember that are using a calendar log or writing out the guidelines to understand everything. And you should call the doctor if any of your symptoms worsen, like pain in the eye, shortness of breath, nausea, vomiting, loss of vision, non-reactive pupils, reddening of the sclera, bleeding, discharge, or tingling of the hands and feet.